My name is Cassidy Welch. I am a fourth-year medical student, and I've been volunteering at the MSAC for a little while, so I might know you and have had the pleasure of meeting you. But today I'm just going over two different topics that I hope are helpful and informative. One of them is just an overview of what current research looks like with progressive MS specifically, and then I'm also going to talk about spasticity management options later as well. So first off, I'll just kind of give you a rundown of what I'm going to talk about here. And firstly, I'll just give you some background on research currently. I'll talk about some current therapies, some therapies that are upcoming, and then I'll also talk about biomarkers, what that means, and how that can be useful. And then I'll go over something called Octopus, and then finish with some things to consider to take home with you. So first, I just wanted to start with some statistics, and that is that 15% of people who have multiple sclerosis have the progressive form. So this is not the most common type of multiple sclerosis. And for a long period of time, therapies have been more focused on targeting inflammation. And those have not been as successful as we had hoped. And newer therapies are looking more at neuroprotection, or how to improve kind of the robustness of your nervous system itself rather than trying to reduce inflammation. And so here I just wanted to kind of go over some popular new medications that are out there. One of them being simvastatin, which was studied in the MS STAT2 study. And this actually is a drug that is used for high cholesterol. So you probably have heard of statins as something that is for hyperlipidemia or having high cholesterol. And it also has some anti-inflammatory components and activity, which was why it was originally tried in patients with multiple sclerosis, thinking that it could be helpful with that. And unfortunately, it wasn't super successful. It was not significantly more effective than placebo. So that one was a bit of a dud. However, there are some other promising ones that are out there. One of them is what's called a PDE inhibitor, and this was studied in the STAT-MS protocol. And this one's called a Butylast. That's the brand name of it. And this was granted fast track designation by the FDA because the results in the phase 2 study were so promising. So that's exciting. And it was found to actually slow the progression of brain atrophy. So it was good at kind of putting a pause on the brain atrophy that's seen with MS. It is still not approved, however, by the FDA. So that one's still kind of in the early phases. And then another one is called siponimod. And siponimod is in the same family as one called fingolimod, which has been around for a little bit longer. So that might be one that people are more familiar with. So this would kind of be a cousin to that. And it was found to be super effective, actually. It was able to not only reduce the size of existing brain lesions, but also to help reduce new ones. So effective in two different kind of ways. And this is in a double-blinded, randomized control trial. So that's kind of the most robust type of study there is. So that was pretty exciting to learn that. However, it will be one that's studied for quite a long period of time. So again, still an early phase 1, but still promising early on. And then I'll also talk about some upcoming therapies. And so these are ones that I think are maybe the most exciting. And Chariot MS is the study name for one that features a drug called cladribine. And cladribine is a medication that has been used a lot in relapsing remitting MS. It had successful studies there. But this new study is actually going to be specifically looking at patients with progressive MS. And specifically in progressive MS patients, those who have lower mobility. And I think this is really exciting because previously lots of these studies had limited their participants only to those who have walking ability. And really it's because it's easier for researchers to measure progression when patients still have quite a lot of mobility that can be measured. Whereas if a patient is in a wheelchair, it's a bit more difficult to have them as a research participant. So this is a great step towards having more inclusive results and seeing some medications be studied in populations with progressive MS, specifically with immobility. Another one is called Oratorio Hand, and this is the medication Ocrevus, or ocrelizumab is the generic name. And this is currently used in some patients with primary progressive MS, but similarly to how I just talked about, it's typically only been in patients who have relatively low disability. So meaning they're still able to walk or only use a cane as a walking aid. And so this new study will expand that. Oratorio Hand is going to specifically look at wheelchair users and patients with that level of mobility. And it'll actually use, as the name implies, hand function as a measure of disease progression. And so it will compare patients with progressive MS, those who are taking Ocrevus versus those who are not, and track their hand function over time to see whether or not there is a benefit in terms of functional status, really, over time. So that's something that's really exciting, I think. Another field is biomarkers, and biomarkers is kind of a complicated word, but really what it just means is bio, meaning that we can use either blood or some sort of a sample taken from a patient's body and use data from that to help us track things. And so in this case, what we're trying to use is two different things that can be tracked over time. And I think the benefit of these not only is that your neurologist could use this as something they check in frequently to see how disease is progressing and where things are at, but it could also be used in new research. So I kind of mentioned how having good measures has been a challenge here, and that it's kind of limited who we've been able to study these different drugs in. But if we have a good marker that is found quickly in a blood draw, then we have some real ground that we can cover here. So the translocator protein is one of those biomarkers, and it was found to correlate strongly with the disability and cognitive function in both relapsing remitting as well as secondary progressive. So across all forms of multiple sclerosis, this was found to correlate with disease severity. So that's exciting and definitely a new role that this one could play. And then another example is N-acetylglucosamine. And similar to above, it is a lab value like the protein above that consistently correlates with subtype progression and disease severity in patients with progressive MS. And then another exciting thing with this one that's unique is that a trial from UC Irvine actually found that using this N-acetylglucosamine as a supplement was effective at increasing repair of myelin and or improving cognition. So I think that's really exciting that it was found to be low in patients who had multiple sclerosis and tracked with severity. And then when it was supplemented in patients with MS, it was actually found to be beneficial. So they're going to do more blinded studies with that and look at side effects and things like that as well. So that's on the horizon, but definitely not something that's used in practice yet. And then there's octopus, which is my favorite part. Octopus is named this way because it's actually a study design rather than a medication itself. And it's named this way because it is a trial with many arms. And I think the piece that's most exciting about this is that it's very flexible and adaptive, which is new for research. Usually it takes a long period of time and there's lots of different phases. But with octopus, there'll be new flexibility. If it's found that a drug works, hopefully things will be expedited so that it's studied more efficiently and can be put into practice as soon as it is safe to do so. And if a drug is found to not work or be ineffective, then it can be pulled from the trial quicker. And a new one that's more promising that could be studied is quickly put in its place. So I think that real-time adjustment piece is really exciting. And this is currently underway in the UK. So unfortunately, unless you move to the UK, you won't be able to participate in this one, but they have a lot of patients with MS that are enrolled in this. So exciting things there. And then I also wanted to just talk about some important considerations that I think bear some thinking about. So I think even if a drug is considered to be effective, there's still things to think about in terms of whether it might be the right treatment for you. So different people can have very different goals, and I think that should be taken into account when you think about whether something is right for you as an individual as opposed to people in general. And then I also kind of listed out some questions to consider when asking your doctor. So a few things that just came to mind were, how big of an effect did the drug have? Which I think is a great question to ask when thinking about adding something new. It's easy to say, well, the drug worked, but how well did it work? How significant of an improvement can I expect? And in the same vein, what sort of symptoms could I see improvement in? Could also be something to think about. And then in what ways was it studied to improve MS? There's lots of different facets of the disease that could be impacted by medications. And so I think that should be thought about as well. And then I think you all probably ask this always, but again, what are the side effects of taking the drug? Thinking about what are the risks in addition to the benefits that might be had from taking a medication. And then, of course, just keep in mind what your goals are, because different people have very different goals. And something that might be bothersome as a symptom to me might not be bothersome to another person. And I think each person should just consider that as an individual, what sort of changes are most appropriate for them. And hopefully future studies will do a better job of actually looking at patient satisfaction as a measure in research as well. So not just what was the improvement with progression, but what was the patient satisfaction with being on this medication too. I think that's really important. And what was the effect on quality of life or functional status or maintaining employment, things like that. And then I also just wanted to point you to another resource I talked about a lot, and I think it might be exciting to keep an eye out for updates on these things I discussed. The National MS Society is a fantastic organization that has really readable material on their website, and they give updates on these studies very frequently. So if you're interested in learning more, or you're just interested in getting news updates on things that I talked about, I'd recommend you head over there. They're very reputable, and I highly recommend taking a look. And then here are just the citations that I used in studies themselves. And now we'll go ahead and transition over to talking about spasticity. So let me go ahead and put this in full screen here. Okay, so some of these things I think you'll probably be quite familiar with, and some of them might be things that are new to you. But I want to just treat this as an informative session. Maybe there's some new things that you want to try for this that you haven't seen before, or maybe I'm just enforcing some things that you already knew, which would be great as well. So let's go down here. I'm basically just going to walk through some different options and talk about some new things maybe. So first and foremost, I would say medications are something that are often used first line for spasticity. I think they're a great place to start, but definitely not a place to end. So there's probably a lot of these that you've heard of before. Baclofen is one of them, clonidine, gabapentin. You could even use benzodiazepines, all of these different medications. And generally, they all have a muscle relaxant component. So they have that similarity amongst themselves as a class, and that's what makes them useful in spasticity. And they also have very different routes. So you could take them by mouth, you could use them as an ointment, you could use them as an IV form if you're ever in the hospital for any reason. And then even if you've heard of a baclofen pump, where it's actually a pump that is putting medication straight into your spinal column as well. That's an option. So again, a good starting point, but I hope not an ending point, because I think there's a lot of other things that are at your disposal as well that are worth a try. So another good option is actually Botox, which I'm sure most people are familiar with. It's very popular even in the cosmetic industry these days. But intramuscular Botox injections in a spastic area specifically. So in the muscles that are contracted can be helpful in helping to relieve that spasticity and can last for between 2 to 4 months. I mentioned how there's actually kind of a give and take here between wanting to maintain muscle function while also reducing spasticity. So there is kind of a balance with all of these techniques and medications, that there is some beneficial role that spasticity plays. It's actually found to be helpful in terms of spasticity. I mean, in terms of reducing pressure sores. It helps with transferring, with moving and things like that, where someone's helping you transfer, say, a wheelchair to a bed or otherwise. It can be helpful in those instances. And really, it maintains muscle tone as well. And so it's beneficial in that regard, that it's keeping a muscle active. So spasticity in and of itself is not an evil, but I would say there is a balance, right? We don't want to totally lose function of a muscle because it's spastic, but also losing function of a muscle because you've relaxed it so much from it being spastic is equally as problematic. So I'll just maintain that with Botox and a lot of these other options, there is a balance between wanting to make sure that you have relieved some spasticity, but that you still have function, which is the ultimate goal here. And then another option is something called continuous muscle stretch. And this is really similar to what you all do at the beginning of group when you come once a week. And it can involve different positioning, stretching, even splinting or bracing. So the premise here is that you stretch for at least 30 minutes. It's great to do it daily. And basically, by taking your muscles and putting them in stretch positions, you're reducing spasticity and then also helping to kind of activate the opposing muscle that might be less active because of spasticity. And so splinting and bracing can also be used if you need more of a passive stretch. If you're unable to stretch yourself in that way, then you can use those additional devices like a brace in order to help with that. And then another thing that I hadn't really thought about before doing more research on this was speech therapy. And spasticity, as well as MS itself, can actually affect your vocalization muscles. And so speech therapy can be a great addition to your care to help you maintain those muscles. And I think that is, a worthwhile place to start always. And there's a lot of great speech therapists out there that can help with that. And then I don't think I really have to harp on this too much because you all know how fantastic occupational therapists are. They are a fantastic resource to help you figure out solutions to spasticity and even other challenges you might have. They are great at helping you achieve your goals and meeting you where you are to help you find solutions to those problems too. So, occupational therapy and physical therapy, I think, have a crucial role to play in helping with spasticity, and I'm sure you would agree with that. Another new one is actually a THC CBD oral mucosal spray. And so it's a little spray bottle that you would actually spray in your mouth. And it is a 1-to-1 mixture of THC and CBD. The name of it is Sativex, and it has been used in the UK for about a decade at least. The FDA spent a very long time studying it. As you can imagine, when there's a bit of stigma around a medication, it takes maybe a little longer for the FDA to see it through. So you can be assured that this one is very extensively studied. And it was found to chronically improve spasticity symptoms in MS, which I think is really exciting because it was not just a little immediate relief that lasted for 5 to 10 minutes, but it's one that chronically helped. Greater than 40% of subjects saw at least a 30% reduction in symptoms. And I also found that it helps relieve some bladder symptoms as well, which I think is another great benefit that's probably one that people could benefit from. There's also a little bit of a sleep aid that's built into this. And so it was found that fatigue was the most common side effect, but it worked really well when it was taken at night. And then patients had relief of their spasticity symptoms overnight. They had better control of their bladder overnight, and they had a sleep aid. So I think that was a great kind of solution there. And the 1-to-1 ratio that I talked about there is actually supposed to limit any sort of psychomotor symptoms. So it's very safe. You actually are allowed to operate machinery while taking this. It is not in any way considered to make you be under the influence in any way. Another option is functional muscle stimulation. And this is a neuromuscular electrical stimulation. And basically what this is activating the muscle for you the same way that a nerve would be doing if it was active and firing on its own. So it kind of crosses that roadblock for you and allows for you to use muscles and retain muscle tone, even if your nerves are not themselves the ones firing. So what this looks like is usually little kind of pads or pieces of foam that would be sitting on your muscle. And then small electrical signals would be causing that muscle to fire. There's different sort of leg and foot boots that are involved with this. There's suits that you can use that allow for muscles to be stimulated. There's lots of different forms that takes, but that's also one that's found to be effective. Constraint-induced movement is another one. And this is actually most commonly used in post-stroke patients. And basically the premise, which I explained, is kind of similar to if you've ever heard of a kid having one eye that's weaker than the other. And you cover the strong eye to help strengthen the weak eye and get it up to par. This is the same way. So, for example, if I had great function of my right hand, but I had poor function of my left hand, well, if I had my right hand kind of taped to my side for a day and was forced to use my left hand, all of a sudden you develop greater strength and greater capacity to use that hand as well. And it was found to be even more effective when it was combined with Botox as well. So interesting to keep that in mind. Another one out there is cold therapy. And cold therapy was great for symptom relief, but it did not have a great overall impact in terms of increasing someone's functionality. So that's important to keep in mind. But for its ease of use, I think maybe it still bears some consideration. And the example that I read about that was studied was using cold packs that were about 50 degrees, So think about maybe if you had put a bag of peas in the fridge or something like that. So not freezing, but cold for about 20 minutes on the spastic area. And that provided some symptom relief. Another one is electromyographic feedback. And this is a little bit similar to the other big one ahead, the big word, I should say, ahead, the functional muscle stimulation. And basically, what this does is uses feedback. It uses sensors and visual cues to tell you how well you're activating a muscle, which is really important because it helps kind of ingrain that brain to muscle connection that might be a little weaker when you have a spastic muscle or you have poor function in a specific area. So this was found to be beneficial, especially when combined with occupational therapy and that functional muscle stimulation that I mentioned above. So it's basically like a check and balance system on telling you whether or not you're doing a good job, what you can improve at, things like that. And then resistance strength training. There have been a few information pieces out there that have said that resistance strength training actually worsens spasticity. And I think that premise is probably because people were worried that kind of the contraction and maintaining a certain level of tone that happens with resistance strength training is similar to spasticity, but this was totally disproven. This is a fantastic way that is very well studied and known to help improve musculoskeletal impairment. And so all of that use of resistance bands and exercising is great for spasticity. And the more you do it, the more it becomes part of a routine of something that happens daily for 30 minutes or so, the better improvement that you'll have in function as well. So hopefully this was helpful, just a little bit of an overview on what some options are with spasticity management. And I would love to also recommend that if you feel like you need someone to talk to about this, there are obviously fantastic occupational therapists and physical therapists at KU and at every major health system in Kansas City. You can also see a doctor in physical medicine and rehabilitation that's great at helping improve functional status. And your neurologist or primary care doctor should be able to help you get a referral for those if you should need one. And then again, here are my citations on these studies, and thank you.